This is our community nursing assessment of Jukwa, Ghana by Emily Nelson, Sasha Martin, and Sky Unrain. Ghana is a country on the western coast of Africa and the home to more than 27 million people. When we were in Ghana, we actually stayed in Cape Coast, which is a fishing town. But when we went to our clinical sites, we went to a rural town called Jukwa. The drive to Jukwa was about 40 minutes by something called a chotro, which is seen here. It's basically like a van that can hold up to 15 to 17 people. A lot of people would take chotros between Jukwa and Cape Coast so they could sell their goods at the market. When we arrived to Jukwa, we instantly fell in love with this inland farming town. We worked with nurses from a health center that served Jukwa and the neighboring villages. As you can see here are some of the rooms inside the health center. There's a disease control unit, reception. They do a lot of family planning there. Mothers can come and have their babies here at this health clinic and also get antenatal care. The nurses that we worked with were absolutely amazing. Most of what they do is outreach in the different communities to bring healthcare to everyone, because in some communities it's more difficult to travel to this healthcare facility. So a lot of what we did when we were there was go to the neighboring villages and talk about different healthcare topics, do home healthcare visits, and do maternal child wellness checkups. Here's some kids that we taught different health topics to. This brings us into our first nursing diagnosis, which is risk of infection related to soil contamination from livestock. So I'm going to go over some statistics about access to water and clean sanitation in Ghana. 6 in 10 households in Ghana have access to an improved source of drinking water. Only 14% of Ghanaian households have an improved, not shared, sanitation facility. This just means if it's improved, that it is protected from outside contamination, especially fecal matter. More than one quarter of households, about 26%, have a non-improved sanitation facility. In rural areas such as Jukwa, 41% of households lack improved sanitation facilities compared to just 14% of households in urban areas like Cape Coast. More than 3 in 4 households in Ghana have electricity. And this is just a graph kind of showing all of the statistics that I just went over. So when we were in Jukwa, we would either see people go to the bathroom by using latrines, or they would go in the back nearby where the animals would be roaming around. We don't have a picture of a latrine here, but we do have some pictures of some animals because mostly we would just see people going in the back. Improved sanitation is harder to find in Jukwa just because it is a smaller, more rural town, and a lot of the communities we went to were even more rural than that. You would see children go off to go use the bathroom, and there would be chickens or goats or roosters just walking by. So now we're going to talk about the spread of disease through animals to humans in Ghana. In a research study we found they studied 428 freshly slaughtered animals that included 130 sheep, 149 cattle, and 149 goats. So these are all animals that you would see very regularly in Ghana. And out of these animals, 144 ticks they found were carrying some sort of disease. Overall, the study detected human exposure to the CCHF virus, which stands for Crimean Congo hemorrhagic fever. So they found that slaughterhouse workers had been exposed to this virus and identified the virus in proven vectors, so the ticks that were on the animals. So basically the study had found that these animals were carrying the ticks and then spreading the disease to human workers in Ghana. So therefore it's been shown that animals have been spreading infection throughout people. We would see animals everywhere in Ghana on a daily basis, as you can see from these pictures. This is just in the villages in Jukwa, not on actual farms. None of these animals were vaccinated, yet you would be in contact with them all the time. We were in a village teaching children about brushing their teeth, and we would see all these kids grabbing sand and putting their hands in their mouth, which if it was just dirt, it wouldn't be as big of a deal, but all the livestock have been going through the area. Their feces and urine are in there somewhere. And now these kids are just taking that and putting that in their mouth. So after seeing livestock in close proximity to the people of Jukwa, um, and seeing how the soil, not only the soil, but the water could have contamination from these animals, that's how we came up with our nursing diagnosis. Our next nursing diagnosis is risk for failure to thrive related to water contamination in children under 5. So now I'm going to talk about some statistics related to children under 5. So nearly 1 in 5 children under 5 in Ghana are stunted or too short for their age. This indicates chronic malnutrition. Stunting is more common among children of less educated mothers at 26%. Wasting, which is a sign of acute malnutrition, is far less common at 5%. In addition, 11% of Ghanaian children are underweight or too thin for their age. The nutritional status of Ghanaian children has generally improved since 2003. In 2003, more than one-third of children were stunted, compared to 19% in 2014. So one of the things that we did in Ghana is that we worked in these child wellness checkup clinics. So mothers with kids under 5 would bring in their kids, and we would weigh them and measure them to make sure they were on target for growth. It was honestly pretty easy to tell if a kid was not on target because they just didn't have that classic chubbiness and rolls that you think of when you think of like a little baby. Um, so one thing that we did is we would counsel the mothers on correct diet because a lot of the issues were the mothers just didn't know they weren't feeding their kids the right types of things, such as exclusive breastfeeding up to 6 months. To go along with this, I'm going to add in some statistics about infant mortality rates for children under 5, because this is often due to the same things that are causing this malnutrition in children. So, infant and under 5 mortality rates in Ghana are 41 and 60 deaths per 1,000 live births, respectively. At these mortality levels, 1 in every 24th Ghanaian children dies before they reach age 1, and 1 in every 17 does not survive their 5th birthday. These rates have overall declined in the past 26 years. So this is kind of a graph showing the infant and childhood mortality. So one thing that we learned a lot about from the nurses in Ghana and we saw is that not a lot of mothers do exclusive breastfeeding up to 6 months. We don't have an actual picture of this, but we have pictures of babies to kind of show you. So it's either because of spiritual reasons or they just don't know. They think the baby's still hungry when they cry, so they end up feeding the baby water and rice to go along with it. Well, the problem is not only can babies not handle water, their bodies are not made for it yet, but also if that water is dirty and already contaminated and that baby gets diarrhea or some waterborne illness from it, that only makes things way worse. And then if the baby's getting diarrhea, they're not getting the nutrition they need, and it's a bad cycle. So a lot of what we did was educating moms on just exclusive breastfeeding, 8 to 12 times per day, because a lot of moms just think, Oh, well, I only eat 3 times a day, so my baby only needs to eat 3 times a day as well. So this is kind of a lot of what we worked with and learned while we were there. And a lot of the reason why there is infant mortality under 5 or under 1 is because of babies getting diarrhea or children getting diarrhea and then having this malnutrition and they just can't make it. So it's kind of hard to show you this through pictures, but just to summarize, um, a lot of the things that we did observe were just kind of a lack of knowledge from mothers on how to feed their children and proper breastfeeding up to 6 months. And this is a main problem they are trying to focus on, the public health nurses, providing this education in order to prevent these children from having failure to thrive and to hopefully decrease these child and infant mortality rates. So that's how we came up with our second diagnosis.
A community strength we saw while in Ghana was low tobacco use. Men were more likely to use tobacco, with cigarettes being the product of choice. Less than 1% of Ghanaian women use tobacco compared to 5% of men. The older people get, the more likely it was for cigarette use. Only 1% of men ages 15 to 19 smoked compared to 11% of men who were ages 45 to 49. However, the more education someone had, it was less likely for cigarette use, with 17% of men with no education smoking compared to 2% of men with second-degree education or higher. Among men who smoked cigarettes, 37% smoked 3 to 5 cigarettes daily. According to tobaccocontrollaws.org, packaging and labeling of tobacco products in Ghana must have at least 50% of the front and 60% of the back covered with warning labels. This could include a picture of a pregnant lady with an egg saying not to smoke while pregnant or how smoking can cause lung damage. Terms used to describe products such as light or mild pertaining to the tar in the product is also prohibited. This picture is showing us first arriving to Ghana. When we exited the airport, we saw a lot of people trying to get to their next location or working, and we didn't really see much smoking. This is when we were leaving the airport headed to Cape Coast, and we noticed that a lot of the billboards were not advertising for tobacco products. When we saw the people on the streets, we did see a few smokers compared to what we saw in the villages, but it still wasn't a lot. When we traveled to our clinical sites, our nurses told us that it was pretty taboo for people to smoke, especially in the smaller villages, especially since they may not be able to go get the cigarettes or they were busy working, so they didn't really have time to smoke. This picture is showing 2 men trying to sell products to people driving by or on the street. Here's an example of a woman trying to sell some waters to people driving by. Her walking and trying to sell products would make it difficult for her to actually take a break and smoke, especially since she's focused on making money So smoking interrupts that. Here's a picture of a woman coming up to us in the trotro trying to sell us some fruit. While we were in Ghana, none of the people that were selling goods on the street were smoking, which is good because if they were, people would probably not buy from them. Another community strength we saw while we were in Ghana was a diet from locally grown, sustainable foods. Many of the villages we visited were far from the city, and many people did not have reliable transportation to drive back and forth. So most of their foods came from them growing their own. These pictures are from a teaching assignment we did that was focused on healthy eating. On the left side were foods that came from the village, so different fruits, vegetables, and grains. And on the right side is a picture of iodine salt that we gave to the people after the teaching. We wanted to include this so they could know the importance of iodine and how being deficient can lead to significant health problems. These are some more pictures from our presentations. We made posters of food that belonged in different food groups. So we had grains that were carbohydrates or meat that was protein, and showed how those foods that they're already familiar with fit into those categories. And then there's just some examples of the foods that they had, like peppers, carrots, rice, onions. We also included in our teaching how drinking from these bags of water or sachets made them less likely to get infections like typhoid fever, and if they were to drink from water that was in their community, that they should boil it before drinking it. They should also wash their fruits and vegetables for the same reason, because they could get infections and get really sick. A lot of the people in the villages didn't have stoves or microwaves to use to cook their food, so a lot of them just cooked outside. This is showing some kettles that they used. They would just start a fire and put the kettle on top to cook the food. This is a picture of the gyri after it was made. A lot of people put this in their soups or stews or even eat it by itself. When it's mixed in with the soups and stews, it kind of has an oatmeal texture. Luckily, we had the opportunity to see it being made and got to actually feel what it was like. While we were in Ghana, a lot of the people did not appear to be overweight or obese. This graph from 2014 took weight and height measurements of men and women ages 15 to 49, and it showed that Ghanaians ranged within normal limits. Men were 74% and women were 54%. Only 6% of Ghanaian women and 10% of men were considered thin, with a BMI less than 18.5. 40% of women and 16% of men were considered overweight or obese, with a BMI greater than 25. As age increased, overweight and obesity was more likely to happen. Only 9% of women and 2% of men ages 15 and 19 were considered overweight or obese, compared to 56% of women and 28% of men ages 40 to 49. Among both sexes, overweight and obesity increased with household wealth. Among women, thinness was slightly decreased since 2003, with 9% to 6% in 2014, while overweight and obesity has increased from 25 to 40% in the same time period.